Hey everyone, welcome back to part 2 for our Chapter 10 lecture. Now to start this off, we'll talk about how can healthcare be coordinated among the multiple institutions that provide healthcare services. So healthcare delivery systems in the US have continued to proliferate, with a wide range of institutions differing in governance, finance, accreditation, and structure. Now as a result, many patients, policymakers, even clinicians don't have a complete understanding of how the system works. And this is concerning, especially when policymakers suggest large changes like universal healthcare without fully understanding the existing problems, or vice versa. And doctors who are well educated in one particular field, but necessary policy, rubber stamp. So healthcare delivery systems aim to connect inpatient and outpatient services, as well as short-term and long-term clinical services, to provide a coordinated system of care. And this isn't a new concept. So historically, the patient's doctor was responsible for coordinating all aspects of care, including inpatient and outpatient services. The doctor would oversee care, communicate with other clinicians, and follow the patient throughout their treatment. However, this model is no longer feasible due to increased workloads, physician shortages, and longer distances between patients and healthcare providers. Now, today there are two primary approaches that are being developed to integrate healthcare systems into a more unified system. We have the development of integrated healthcare delivery systems and the use of integrated electronic medical records. These approaches will likely be combined to create a future system that is more coordinated and efficient. But to understand their uses and potential, we have to contemplate how care coordination is/should be implemented in various healthcare settings. Right, so now what types of coordination of care are needed and what purposes do they serve? So first up, for the traditional approach, care coordination was centered around the doctor-patient relationship. In this model, one provider would manage and oversee the entire episode of care, ensuring continuity over time. This model relied heavily on trust and individualized knowledge of the one-to-one relationship, which helped ensure that care was coordinated and continuous. Now, recently there's been a shift towards focusing on coordinating care on specific episodes or illnesses rather than maintaining continuous care through a single provider with that one-on-one relationship. Now, this shift increases the possibility of gaps in care, and these cracks can grow longer over time and lead to inefficiencies or missed opportunities for treatment. Now going over the types of coordination, so we have clinician, and clinician-patient. So effective communication and collaboration between healthcare providers as well as between clinicians and patients is critical for smooth coordination. Then we also have institutional coordination, since different healthcare institutions must work together to provide a seamless experience for patients. Then we also have financial coordination, since financial factors such as insurance coverage can significantly impact coordination. If one setting covers certain services but another doesn't, it can create inefficiencies. We also have coordination between healthcare and public health. So coordination between the healthcare systems and public health initiatives is necessary to address population health concerns and improve outcomes. All right, now what we have here is table 10.2, which is providing a detailed overview of the various types of care coordination, including the functions they aim to serve and the challenges faced when implementing them. So this table categorizes care coordination into different types, such as clinician-patient coordination, institutional coordination, and financial coordination. Now for each type, the table identifies its intended function, how it's supposed to improve the healthcare system and ensure better patient outcomes. Now alongside each type of coordination, the table also lists common challenges that arise in the real-world implementation of these coordination efforts. These challenges might include issues like communication breakdowns, insufficient technology, or financial constraints, which can hinder effective coordination and integration of care. Now, why it's important to understand is that understanding the types of coordination, their goals, and the barriers to be successful implementation can help healthcare providers and policymakers identify areas of improvement in the system. This knowledge is crucial for improving patient outcomes and ensuring that healthcare delivery is more efficient and effective. Okay, so now what types of healthcare delivery systems are being developed, and how can they help ensure the coordination of healthcare? Because in the United States, healthcare is provided by a wide variety of institutions and providers, and it makes it difficult to ensure seamless coordination across the system. Now, this diversity in providers often leads to fragmented care, making it harder to ensure that patients receive continuous and comprehensive care. But there have been some efforts to improve these coordination issues. As to address these challenges, healthcare delivery systems are being developed based on ownership/governance. And these systems are often based on integrated models where a single entity provides a broad range of services, including inpatient care, home health, skilled nursing, and custodial nursing home care. And the aim here is to streamline care and reduce fragmentation. Now, two examples of long-standing successful integrated healthcare systems are Kaiser Permanente and the Veterans Administration, or VA. Both systems have been designed to offer comprehensive, coordinated care to their defined populations, improving outcomes and patient satisfaction by integrating services under one umbrella. Now, in addition to Kaiser Permanente and the VA, there are increasing numbers of healthcare delivery systems being developed by other clinicians and institutions, such as multi-specialty group practices and university medical centers. These new systems aim to integrate various levels of care, providing better coordination and outcomes. Additionally, there are Medicare demonstration programs that are testing new ways to improve the functioning of existing systems by promoting cost-effective care and incentivizing better performance. All right, now changing our focus, we're going to go over how can electronic medical records be used to facilitate coordination of care and improve the quality. So there's widespread agreement that electronic health record systems have the potential to significantly improve coordination of care and help achieve various quality objectives. The National Academy of Medicine outlines several ways EHRs, electronic health records, can improve care coordination, which include health information and data, so storing lab results, pharmacy data, and patient history for easy access and sharing among healthcare providers. There's also results management, for integration of findings from multiple healthcare settings to give clinicians a more complete picture of a patient's health. We also have order entry/management, for here electronic ordering of tests and prescriptions, which increases speed and accuracy, reducing errors and delays. So maybe some of the potential errors could be simply just terrible handwriting, or you can't tell which box was actually checked. So that could be an example. We also see decision support management, where it's reminders and prompts provided by the EHR system to ensure timely follow-up and care. There's also electronic communication and connectivity, facilitating communication between healthcare providers and between providers and patients, improving overall engagement and coordination. We also have patient support, as EHRs can offer tools for patient education, helping patients be more involved in decision-making processes regarding their care. There's also administrative processes, where streamlining administrative tasks such as scheduling, billing, and insurance coordination, which reduces overhead and enhances efficiency. Then there's reporting and population health. So EHRs help in the collection and reporting of data for public health surveillance, improving reporting efficiency and aiding in population-level health initiatives. All right, and also the National Academy of Medicine has also concluded that electronic health record systems play a critical role in improving quality and efficiency in healthcare. So first off, one benefit they give is that it improves patient safety. EHRs help prevent harm to patients. In the US, tens of thousands of people die each year from preventable adverse events in healthcare settings. EHRs can reduce these errors through real-time monitoring and alerts. They also give support effective patient care. So effective care is based on scientific knowledge and tailored to individuals who can benefit. Yet only about 55% of Americans receive medical care that adheres to guidelines. EHRs help ensure adherences to clinical guidelines, reducing unnecessary or even harmful treatments. They can also help facilitate management of chronic conditions, as many individuals with chronic conditions see multiple providers, often receiving conflicting information and duplicate tests. EHRs provide a unified accessible system for managing complex patient care and coordinating between specialists, improving care consistency. They will also help improve efficiency, as efficiency is about avoiding waste, whether of time, supplies, or professional expertise. EHRs reduce cost and waste by streamlining workflows, minimizing unnecessary tests, and improving care coordination. Now going more into what we call Cures role and Open Notes. The Cures role and initiatives like Open Notes are aimed at making medical information more accessible to patients in real time. The goal is to empower patients by allowing them to engage in their own care decisions, improving transparency, and promoting collaboration. Now, the funding for this implementation is from the US government, which kickstarted the push for a national electronic health record system with a $20 billion investment as part of the 2009-2010 stimulus package. This initiative aims to improve the nationwide implementation of EHRs, making healthcare more efficient and accessible. All right, so now how is technology changing the way healthcare systems deliver care? So technology is transforming healthcare delivery by making it more convenient, effective, and cost efficient. Over the past few years, certain technologies have gained significant traction, particularly during the COVID-19 pandemic, one of which is telemedicine. And telemedicine refers to remote consultations between healthcare providers and patients, often facilitated by two-way communication technologies like audio and video. It can be synchronous, where both parties interact in real time, or asynchronous, which involves indirect communication through text, email, or mobile applications. Now for the benefits of telemedicine, it makes it convenient for patients, reducing the need to take time off work or travel for appointments, improves access to healthcare, especially in remote or underserved areas, and reduces healthcare system strain by offering care alternatives when in-person visits may be difficult or unnecessary. Now we also see the rise of home testing, which also has made healthcare more accessible. Examples include home collection kits for lab samples, which patients send to clinics or labs via mail, as well as devices that provide immediate results like home pregnancy tests or at-home HIV testing. These tests allow for greater convenience and privacy, helping individuals manage their health without leaving home. We also have seen remote monitoring. So technologies that enable remote monitoring allow patients to track their health conditions and share data with healthcare providers in real time. Examples include continuous blood glucose monitoring for diabetes, blood pressure tracking, and EKG monitoring, which can be done through wearable devices. Remote monitoring offers the advantage of continuous care and early intervention, improving health outcomes and preventing complications. Now, these technologies have the potential to make healthcare more accessible and cost-effective. Over time, they aim to reduce the need for costly in-person visits and hospital stays, while improving health management for individuals. So now what mechanisms are being used to monitor and ensure the quality of healthcare in the United States? So to ensure high-quality healthcare delivery, various mechanisms and methods are implemented at both the institutional and individual levels. These mechanisms ensure that health professionals are well educated, prepared, and held accountable for their practice. First off, we have the accreditation of academic institutions. Since accreditation ensures that educational institutions meet specific standards for training healthcare professionals. This helps maintain a constant level of quality in medical and nursing schools, ensuring that students receive the knowledge and skills needed to provide competent care. Accreditation also promotes ongoing improvements in curriculum and teaching methods. We also have the credentialing of health professionals. This credentialing refers to the process of verifying the qualifications of healthcare professionals. So this includes confirming educational background, training, licensure, and experience. Ensuring that only qualified individuals are allowed to practice healthcare is a crucial step in maintaining the quality of care. We also have continuing education and recertification, as healthcare is an ever-evolving field, and professionals must stay current with the latest research, techniques, and best practices. Increasing requirements for continuing education, recertification, and maintaining licensure ensures that healthcare workers keep up with the changes in their respective fields. These processes help improve care by ensuring that providers remain knowledgeable and competent throughout their careers. There's also a pay-for-performance approach. As to link compensation with quality of care, pay-for-performance approaches have become more common. Under these systems, healthcare providers are financially incentivized to meet quality standards, improving care delivery. So, for example, doctors and hospitals may receive bonuses for achieving certain patient outcome targets or for reducing hospital readmission rates. And the system aligns financial incentives with the goal of delivering high quality care. In addition to accreditation, credentialing, and pay for performance methods, several other mechanisms are in place to ensure healthcare quality. First off, we have evidence-based recommendations and clinical guidelines. Evidence-based recommendations are developed by expert panels and organizations to guide clinical practice. These guidelines use the best available research to recommend treatment protocols, procedures, and care strategies. Following these guidelines helps healthcare professionals deliver care that is proven to be effective and improves patient outcomes. There's also hospital privileges and approval for procedures. As hospital privileges refer to the process by which hospitals grant clinicians the right to practice within their facility. Criteria for granting privileges may include approval from specialty or subspecialty boards, which ensures that the clinician has demonstrated the necessary competence, either through training or experience, before performing specific procedures. This process ensures that only qualified individuals are permitted to perform specialized tasks, maintaining safety and quality within the facility. We also have the accreditation of additional healthcare organizations. So in addition to academic institutions and individual providers, healthcare organizations such as clinics, nursing homes, and outpatient centers are also accredited to meet specific quality standards. And this further ensures that patients receive consistent, high-quality care across a wide range of healthcare settings. We also have patient safety efforts, as patient safety initiatives are critical for minimizing medical errors, preventing harm, and improving healthcare quality. These efforts can include implementing safety protocols, monitoring adverse events, and educating healthcare providers on safe practices. Improving patient safety not only reduces risks, but also enhances the overall quality of care. There's also malpractice liability for health professionals, as malpractice liability holds healthcare professionals accountable for mistakes or negligence that result in patient harm. That serves as a financial and legal deterrent, encouraging providers to maintain high standards of care. And the fewer malpractice suits encourage providers to follow best practices and to document care thoroughly to avoid potential liability. And also we have acknowledgement of errors with potential compensation, as some healthcare systems are working to promote transparency by encouraging the acknowledgement of errors when they occur. In some cases, this may lead to compensation for patients affected by preventable mistakes. Acknowledging errors and compensating patients can build trust in the healthcare system and improve the overall safety culture. And that is all for this lecture. Thank you for your time.